Welcome back, everyone, for another daily deep dive into healthcare news.
So much happening every day.
It's a lot to keep up with.
Absolutely. Let's dive right in, shall we?
Yeah, sounds good.
Well, first up, this week Abridge just got a ton of money.
Like, how much are we talking?
$250 million.
Wow, for an AI clinical documentation company, that's huge.
It is, and it really shows the direction healthcare's going.
Definitely. I mean, even physicians themselves are starting to see the potential of AI.
Oh, yeah, for sure.
That AMI study we were talking about earlier showed a pretty big shift in their attitudes.
Yeah, a lot more doctors are embracing AI now.
And it's not just talk either.
No, you see hospitals putting their money where their mouth is, right?
Exactly. Like Memorial Hermann Health System.
I saw that.
They just invested in an imaging data startup.
Interesting. What's the angle there?
They're hoping to use AI to get better at predicting how diseases will develop.
So kind of getting ahead of the curve.
Exactly. And that seems to be the big trend right now, using AI to predict things.
Yeah, you can see it everywhere, from analyzing scans to looking at genetic data.
It's almost like we're moving from reactive care to proactive care.
In a way, yeah, but of course there are always those ethical questions.
Oh, absolutely, like data privacy and algorithmic bias.
Those are big ones we can't ignore.
For sure. But speaking of AI being used in a big way,
Yeah.
there's that trial going on in South Australia that I find fascinating.
Oh, tell me about it.
They're using this AI tool called RapidX AI in the ER.
And what's it doing?
It's supposed to help doctors diagnose heart problems faster.
So like in those critical moments when every second counts.
Exactly. It analyzes clinical and biochemical data super fast.
Wow. I mean, it's amazing how AI is being used in such high-pressure situations.
Right. But then the question is, how do we actually know these AI tools are doing what they're supposed to?
Ah, good point. Well, that's where this other AI platform comes in.
You mean proliferaging?
That's the one.
So we're using AI to check AI.
It sounds kind of meta, but it makes sense.
It's basically designed to assess how these other AI tools are performing in real hospitals.
And it uses feedback from both AI and human researchers.
So it's not just a machine making the judgment call.
Exactly. It's a collaboration.
That's reassuring.
Definitely. But, not every AI story is sunshine and roses.
Oh, right. You're talking about that shadow AI thing?
Yeah, it's a bit of a wild west out there.
So what is it exactly?
Basically, you have these hospital employees creating their own AI apps.
Like rogue apps?
Kind of. And the scary part is the IT department often doesn't even know about them.
That sounds like a security nightmare waiting to happen.
It really is. Imagine sensitive patient data ending up on some unapproved app.
Yikes. It's a good reminder that cybersecurity is more important than ever with all this AI integration.
Couldn't agree more.
And, on a slightly lighter note,
Yeah.
did you hear about Apple's attempt at generative AI?
Apple Intelligence, right.
That's the one from what I've seen online. It's getting more laughs than praise.
Sounds like even the tech giants can stumble when it comes to AI.
For sure. But hey, let's move on to something a little less techy.
Okay, what do you have in mind?
How about physician burnout?
Ooh, that's a tough one. It just doesn't seem to go away.
No, and the crazy thing is,
Yeah.
it's often caused by things like inefficient scheduling and all the administrative stuff doctors have to deal with.
It's true. All that paperwork and bureaucracy can really weigh them down.
But there are some places trying to combat it in interesting ways.
Oh, like who?
Well, Fox Chase Cancer Center in Philadelphia, for example.
What are they doing?
They're trying out a 4-day work week for nurse managers.
A 4-day work week? Wow, that's a bold move.
It is. It's just a pilot program for now, but the hope is that it'll improve work-life balance and maybe even reduce burnout.
That makes sense. A rested and engaged workforce is definitely better for everyone.
Absolutely. But even if we solve burnout, there's another problem looming on the horizon.
Oh, what's that?
A shortage of primary care doctors.
It's been a growing issue for a while now, hasn't it?
Yeah, and there was this report card that linked it to the rising rates of chronic diseases.
That makes sense. Fewer primary care doctors mean less preventative care, and that can lead to more chronic illnesses down the line.
It's a vicious cycle.
It is.
But, there's been some talk about advanced practice providers filling the gap.
You mean like nurse practitioners and physician assistants?
Exactly. They could really help take some of the pressure off.
Yeah, and a lot of states have even given them independent practice authority.
But there's still that issue with payment models.
Right. They tend to favor traditional physician-led care.
It's a financial disincentive for team-based care.
And that ultimately limits patient access, which is the opposite of what we want.
Exactly.
It's like we're stuck in this system that's slow to adapt to the changing reality of healthcare.
I hear you. But hey, before we get too doom and gloom,
Yeah.
let's talk about some public health challenges, shall we?
Okay, fire away.
Well, this new survey from Florida got my attention.
What did it say?
Apparently, there's a pretty big lack of knowledge about heart health among the public.
Oh, wow, that's concerning.
It highlights the need for more public health education.
Definitely, we need to empower people to take care of their hearts.
And of course, we can't forget about cancer.
No, it's still a major threat.
The American Cancer Society estimates there will be 2 million new cases this year alone.
2 million, that's a staggering number.
It is. It really emphasizes how important those cancer screenings are.
Absolutely. Early detection can make all the difference.
And then there's the flu.
Ah, yes, the flu. It's been making headlines
It's
right
hit
now.
high severity status in the U.S. with deaths actually surpassing those from COVID.
That's sobering. It reminds us that the flu is not something to be taken lightly.
Exactly. And this whole situation brings up the issue of trust.
Trust in healthcare institutions, you mean?
Yeah, it took a big hit during the pandemic.
It did. There was so much misinformation and conflicting messaging.
And that's something that's still affecting us today.
Absolutely. This Pew Research Center study really drove that point home.
They found that there's still a huge partisan divide in how Americans view the pandemic.
It's almost like we're living in two different realities.
In a way, yeah, it's pretty stark.
Like, take that statistic about the media exaggerating the risks of COVID.
80% of Republicans believe that compared to only 30% of Democrats.
It's a massive gap.
And it's not just about the media either. This partisan lens also colors perceptions of public health officials and all those restrictions we had during the pandemic.
It's like we're talking past each other.
It really is. But hey, there was one hopeful finding in that study.
Oh, tell me.
2/3 of people across the board felt like they could influence organizations if those organizations actually understood what people like them needed and wanted.
That's an interesting takeaway. It suggests that there's a desire for connection and understanding even amidst all the division.
Maybe there's still some common ground to be found.
I'd like to think so.
Me too. But for now, we're going to take a quick break and we'll be back with more healthcare news right after this.
It's crazy how much there is to talk about when it comes to healthcare these days.
I know, right? It never slows down.
Okay, so let's talk about some good news for a change.
Yeah, let's do that.
Some positive developments in healthcare innovation and access.
Sounds good to me.
Like this hospital-at-home program that St. Luke's Health System in Idaho just launched.
Oh, yeah, I read about that. It's a really interesting model.
It is, especially for folks in rural areas or people who have trouble getting around.
Makes a lot of sense.
And speaking of access,
Yeah.
the NHS in England is trying to make HIV testing more widely available.
How so?
They're making it available in more emergency departments.
That's a great idea. It'll help catch cases earlier.
Exactly, and early detection is key.
And speaking of early detection,
Yeah.
did you hear about those surgeons at NYU Langone?
No, what happened?
They implanted the world's tiniest pacemaker into a newborn baby.
Wow, that's incredible.
It's a pretty amazing story.
It is. It really highlights the incredible advances in medical technology.
And the skill of these surgeons.
Oh, for sure.
And hey, while we're on the topic of amazing healthcare professionals,
Yeah.
let's talk about what's happening in Victoria, Australia.
Okay, what's going on there?
They're taking steps to improve those nurse and midwife to patient ratios.
That's a really important issue
It is. It can make a big difference in the quality of care.
for both patients and the healthcare workers themselves.
Absolutely.
So, let's switch gears a bit
Okay.
and talk about the financial side of things.
Please fire away.
Ascension, that huge healthcare system,
Yeah.
they just reported a $143 million operating loss for the second quarter.
Wow, that's a big hit.
It is, and it really shows the financial pressures hospitals are facing these days.
What do you think is causing it?
Well, a lot of things, rising costs, declining reimbursements, the usual suspects.
It's tough.
It is, and it's fueling that trend of hospital consolidation that we've been talking about.
Yeah, smaller hospitals are really struggling to stay independent.
It's a shame in a way, but it's the reality of the market.
And there's even this research article going around that's looking at the role of private equity in all this.
Oh, interesting. I'll have to check that out.
It's worth a read.
Definitely. But let's move on to something a little more policy-focused.
All right, what do you have in mind?
Well, the debate about Medicaid is heating up again.
It's always a hot topic.
It is, and it looks like Congress might be considering some major changes to Medicaid's coverage and financing this year.
That's a big deal.
It is. Medicaid is a lifeline for so many people.
Any changes will have huge implications for the whole healthcare system.
Absolutely. And, speaking of implications,
Yeah.
there's this story about St. Vincent's Catholic Medical Centers in New York.
Well, what happened?
They agreed to pay $29 million to settle allegations of concealing overpayments for services they provided to military families.
So basically, they were overcharging.
That's the gist of it, and it highlights the need for transparency and accountability in healthcare.
Definitely.
And speaking of accountability,
What's going?
you know about the appointment of Robert F. Kennedy Jr. as the head of HHS, right?
Yeah, I saw that. It's a pretty controversial pick.
It is. His stance on vaccines and other public health issues has a lot of people concerned.
For sure. It'll be interesting to see how it all plays out.
Definitely a development worth watching.
Now, before we move on from the pandemic entirely,
Yeah.
there was one more thing in that Pew Research Center study that I wanted to mention.
Okay, what is it?
It found that most Americans believe COVID drove the nation further apart.
Yeah, it's sad, but not surprising.
I know, and a significant portion of people said they felt like the pandemic took a personal toll on them.
Oh, absolutely. It was a traumatic experience for so many
And it really highlights the need for healing and rebuilding trust.
in a post-pandemic world.
It's not going to be easy, but it's something we need to work towards.
I agree.
But for now,
Yeah.
let's switch gears and talk about something a little lighter.
Okay, sounds good.
Have you heard about this new coalition in Malaysia called Childhood Cancer Malaysia, or CCM?
No, tell me about it.
It's actually a group of 7 different childhood cancer support groups coming together.
Oh, wow, that's incredible.
It is. They're going to advocate for better care and outcomes for kids battling cancer.
That's
It
amazing.
really shows the power of collaboration.
Absolutely. And speaking of collaboration,
Yeah.
over in the Philippines, the Ilocos Training and Regional Medical Center just got a really cool new piece of equipment.
Oh, I read about that. It's the country's first helium-free MRI machine, right?
That's the one. It's a big deal.
It is. Not only is it more sustainable,
Yeah,
it's just as accurate as those traditional machines.
that's
It's
amazing.
a win-win for patients and the environment.
I love those kinds of stories.
Me too.
Okay, so remember a bridge?
The AI clinical documentation company that just got all that funding?
Yeah, that's the one. Well, they're making even more waves.
What are they up to now?
They're using that new funding to develop their AI-powered clinical documentation platform even further.
Interesting.
It could really streamline those administrative tasks for doctors and nurses.
Which could free up more time for patient care.
Exactly. It's all about making technology work for us, not against us.
Now let's talk about some new research that's getting a lot of attention.
Okay, what's the scoop?
It's about those GLP-1 drugs.
Oh, the ones they usually use for type 2 diabetes?
Yeah, but lately they've been making headlines for their potential weight loss benefits.
I've heard about that. It's pretty exciting.
It is, but this new study published in JAMA Psychiatry found that the GLP-1 drug semaglutide could actually help people with alcohol use disorder.
Really? That's fascinating.
I know it could lead to new treatment options for a really challenging condition.
That's always good news.
It is, and speaking of new approaches to health,
Yeah.
have you heard about this food as medicine concept that's gaining traction?
Oh, yeah. It's a really interesting movement.
It is. It's all about recognizing the power of food to prevent and treat chronic diseases.
It makes a lot of sense.
It does, and several big healthcare organizations are getting on board.
Oh, like who?
Well, Tufts University, Kaiser Permanente, and a few others have joined forces to create this Food as Medicine National Network of Excellence,
What's the goal there?
basically to develop, evaluate, and share best practices in this field.
That's great. It's all about collaboration and knowledge sharing.
Exactly.
Okay, so remember that pilot program at Fox Chase Cancer Center we were talking about earlier?
The one with the 4-day work week for nurse managers?
Yeah, that one. Well, it turns out they're not the only ones trying to tackle physician burnout.
Oh, really? Who else is doing something interesting?
Well, Memorial Hermann Health System in Houston is taking a more tech-focused approach.
How so?
They're investing in that imaging data startup we talked about earlier.
Ah, I see. So they're hoping to use AI to lighten the workload for doctors.
That's the idea.
It's a pretty innovative approach.
It is, and it could potentially improve patient outcomes too by allowing for earlier interventions.
So it's a win-win.
Potentially, yeah.
Now let's talk about a fascinating study that's giving us new insights into the human brain.
Oh, I love brain stuff. What did they find?
Okay, so these researchers used deep learning models to analyze brain data.
Okay.
But here's the interesting part. They didn't just look at human brains.
Oh, really? Whose brains did they look at?
They also looked at brains from mice and chickens.
Wow, that's a strange combination.
It is, but it allowed them to see how brains have evolved over millions of years.
What did they learn?
Well, they found that some types of brain cells have stayed pretty much the same across all 3 species.
Wow, even after all that time?
Exactly, but other types of brain cells have changed significantly.
That's fascinating. It's like looking back in time.
It is, and it could help us understand neurological disorders better and maybe even lead to new treatments.
That would be amazing.
It would? Now let's talk about a big pharmaceutical company that's embracing AI in a big way.
Oh, which one?
Merck. They're using AI to speed up the process of discovering new drugs.
That makes sense. It's a pretty data-heavy field.
Exactly. They're analyzing tons of clinical data to identify promising drugs and drug combinations.
It's like having a super-powered research assistant.
It is, but here's the important part.
What's that?
They're not letting AI make all the decisions.
Oh, good. I mean, AI is a great tool, but it shouldn't replace human judgment.
Exactly. They still have a human in the loop.
That's reassuring.
It shows they're committed to using AI responsibly.
Now let's talk about a company that's making waves in primary care.
Okay, who are we talking about?
Aledade.
I've heard of them. What do they do?
They're all about supporting primary care practices and value-based care programs.
Ah, so they're trying to shift the focus from quantity to quality.
Exactly, rewarding providers for keeping patients healthy rather than just treating them when they're sick.
It's a really important shift.
It is, and Aledade is doing some great work in this area.
Like what?
Well, they've expanded their network significantly, and now they have over 2,400 primary care providers serving almost 3 million patients.
Wow, that's a huge reach.
It is, and they're also getting more involved in healthcare policy.
How so?
They've formalized their policy institute.
Interesting. What will that do?
They'll be advocating for value-based care, payment system reforms, competition interoperability, all the big issues.
It's good to see organizations like that taking a proactive approach to shaping healthcare policy.
Definitely, it's important to have those voices at the table.
Now let's talk about a partnership that's bringing together two really exciting areas of healthcare:
Oh, I love partnerships. What are we talking about?
AI-powered monitoring and virtual care.
Wow, that's a powerful combination.
It is. The companies involved are BioIntelliSense and Hiquity Health.
Okay, and what are they doing together?
They're joining forces to offer a comprehensive solution for remote patient monitoring.
That's amazing. It could really help hospitals that are short-staffed.
Exactly, and it allows them to provide high-quality care to patients even if they're not physically in the hospital.
It's a win-win situation.
Now let's talk about a shift that's happening in how we think about patient engagement.
Okay, what's the new thinking?
It's not just about engaging patients anymore.
Oh, really? What is it about then?
It's about activating them.
Activating them, what does that mean?
It means empowering patients to take control of their health and make informed decisions about their care.
So it's like going from passive recipients of care to active participants.
Exactly, and it's not just a feel-good concept.
Oh, really?
There's actually a measure called the Patient Activation Measure, or PAM.
Okay, and what does it show?
It shows that activated patients have fewer emergency room visits and better overall health outcomes.
So it's good for everyone.
Exactly, and it's not that complicated to achieve.
How do we activate patients?
Well, it starts with addressing social determinants of health.
So making sure people have access to things like healthy food and safe housing.
Exactly, those things have a huge impact on health.
They do, and we also need to connect patients with resources that support their overall well-being.
Like what?
Things like peer mentors and support workers, people who can build trust and help bridge gaps in care.
It's about creating a supportive ecosystem.
Exactly.
Now, remember that discussion we had about Ascension's financial losses?
Yeah, it was a pretty sobering reminder of the challenges hospitals are facing.
It was, and it's all part of this larger trend of hospital consolidation that we've been seeing.
With smaller hospitals getting swallowed up by bigger systems.
Exactly, and there's a lot of debate about the role of private equity in all of this.
Yeah. Are they helping or hurting the healthcare system?
It's a complicated question.
It is, and it's one that we need to keep asking.
Definitely.
Now let's talk about Medicaid again.
It seems like it's always in the news,
It is. It's such a vital program for so many people.
but it's also really complex and often misunderstood.
That's true.
Well, the good news is that the Kaiser Family Foundation just released a new brief that explains everything you need to know about Medicaid.
Oh, that's helpful.
It is, especially since Congress might be making some big changes to the program soon.
We'll have to keep an eye on that.
Now let's hop across the pond to the UK.
Okay, what's happening there?
Well, GP practices are facing some serious challenges.
Oh no, what kind of challenges?
Rising costs, administrative burdens, the usual suspects.
It sounds familiar,
It is, and it's putting a lot of pressure on primary care.
which is bad news for everyone.
Exactly. Primary care is the foundation of a strong healthcare system.
If it crumbles, the whole system is in trouble.
And some practices are even starting to consider redundancies.
Really? That's a worrying sign.
It is. It means they're having to let people go because they can't afford to keep them.
It sounds like they need more support.
They do. Now, let's talk about a condition that often gets overlooked:
Okay, what is it?
ADHD.
Really? I thought that was just a childhood thing.
It can be, but it can also affect adults,
Even doctors.
especially doctors.
You're kidding.
Nope, research suggests that doctors who are seeking mental health support should be screened for ADHD.
That's interesting. Why is that?
Because evidence suggests that ADHD is significantly underdiagnosed in doctors.
Wow, I never would have thought of that.
It's important for doctors to have access to the same level of care and support as their patients.
Makes sense.
And addressing mental health concerns can help them be better doctors, too.
Absolutely.
Speaking of challenges facing healthcare professionals,
Yeah.
administrative burden is still a huge problem.
It's the bane of every doctor and nurse's existence.
I know, right? It takes so much time away from patient care.
And it leads to burnout and frustration.
There was a report in the UK recently that called NHS administration dysfunctional.
Ouch.
Yeah, apparently it's driving up GP workload and undermining care.
That's not good.
It's not. We need to find ways to streamline those administrative processes.
And make technology work for us, not against us.
Absolutely. But hey, let's end this segment on a positive note.
Okay, I like positive notes.
Well, almost 24 GP practices in the UK that are involved in research just got a nice chunk of funding.
How much are we talking?
Almost £1 million.
Wow, what are they going to do with it?
They're going to use it to develop research hubs.
That's fantastic.
It'll help them contribute to cutting-edge research which could lead to breakthroughs that benefit patients all over the world.
I love it when primary care gets involved in research.
Me too. That's so important.
Okay, so before we wrap up this segment, I
Yeah.
read this really thought-provoking article in The Atlantic.
Oh, tell me about it.
It was about this phenomenon they're calling the Democratic baby bust.
The Democratic baby bust, what's that?
Basically, it's the trend of declining birth rates among Democrats.
Really? And when did this start happening?
Apparently, it really took off during the Trump presidency.
Wow, that's interesting.
It is. The article explored a bunch of possible explanations.
Like what?
Economic anxiety, social trends, political polarization, all the usual suspects.
It's a complicated issue for sure.
It is, but it's one that's worth thinking about.
I agree. So we've covered a lot of ground in this segment, but we're not done yet. We'll be back with a final roundup of healthcare news after a quick break.
We've talked about so much today, it's hard to believe there's more.
I know, right? But that's the thing about healthcare. It's constantly changing and evolving.
So true. Always something new happening.
Well, let's jump into a few more interesting stories, shall we?
Sure, sounds good.
All right, so first up, Pam Health is building a new rehabilitation hospital in Ohio.
That's great news. Rehab hospitals are so important for helping people recover after illness or injury.
It is, and it's great to see investments like that in healthcare infrastructure.
Absolutely. Speaking of which, construction has also begun on a new day case surgery and imaging center at Harrogate District Hospital in the UK.
Oh, wow, that's impressive. It's encouraging to see these kinds of projects happening all over the world.
Definitely, it shows that healthcare is a global priority.
Now let's talk about technology partnerships, which are becoming more and more common in healthcare.
Oh, for sure. They can be really powerful.
Like this one between Ready Set Surgical and LGI Healthcare Solutions.
Okay, I'm not familiar with them. What do they do?
Well, they've teamed up to create a solution that will help Meditech software users.
Meditech, that's a pretty big electronic health record system, right?
It is, and this new solution will allow Meditech users to connect with more advanced applications.
Ah, so it's all about improving interoperability and streamlining workflows.
Exactly.
And speaking of streamlining workflows,
Yeah?
Highmark just added Sword Health's virtual pelvic health program as a benefit for their health plan members.
Oh, wow. That's fantastic. It's great to see more and more focus on public health.
It is. It's such an important aspect of overall well-being.
And virtual care can make it much more accessible for people.
Absolutely, especially for those who might feel uncomfortable seeking in-person care.
Definitely. Now let's talk about something that might seem a little less glamorous, but is still incredibly important.
Okay, I'm intrigued. What is it?
Hospital beds.
Hospital beds, really?
I know it might not sound exciting, but Stryker just launched a new bed called Proceed.
Okay, and what's so special about it?
Well, it's designed to make things easier for healthcare staff and more comfortable and safe for patients.
Ah, so it's all about those little details that can make a big difference.
Exactly.
Okay, so remember BioIntelliSense and Acuity Health?
The companies that partnered to offer continuous patient monitoring?
Yeah, that's right. Well, their partnership is a great example of how technology can help address the staffing challenges that hospitals are facing.
It's a win-win for everyone.
Absolutely. Now let's talk about another company that's using technology in a really innovative way.
Okay, which one?
VoiceCare AI.
What do they do?
They're using generative AI to automate back office operations in healthcare.
Oh, wow, that's interesting.
It could really streamline things and free up staff to focus on patient care.
And potentially save money, too.
Exactly.
Speaking of saving money,
Yeah.
the New South Wales government in Australia just unveiled new designs for the Milton Ulladulla Hospital upgrade,
It's always good to see investments in healthcare infrastructure.
especially in rural areas where access to care can be limited.
Absolutely.
And while we're on the topic of expanding access,
Yeah.
the NHS in England is continuing to make HIV testing more widely available.
That's great news. Early detection is so important.
It is, and they're doing it by rolling out HIV testing to more emergency departments.
That makes a lot of sense. It's a place where people are already seeking care.
Exactly. And over in India, Fortis Healthcare is expanding its reach by acquiring a super specialty hospital in Punjab.
That's a big move.
It reflects the growing healthcare market in India, and it will increase access to specialized care for people in the region.
That's fantastic.
So we've covered a lot of ground today, haven't we?
We have from AI to hospital beds to everything in between.
But before we sign off,
Yeah.
I want to circle back to something we talked about earlier.
Okay, what's that?
That Pew Research Center study about the lasting impacts of the COVID-19 pandemic.
Oh, right, the one that showed how divided we are as a nation.
Exactly. It was a pretty sobering reminder of how much work we still have to do to heal and rebuild trust.
I agree. It's not going to be easy, but it's essential. And, it's not just about trust in institutions or the media.
No, it's also about trust in each other.
Exactly. We need to find a way to come together and have those difficult conversations with empathy and understanding.
Well, you said.
It's the only way we're going to move forward as a society.
And hopefully create a better future for healthcare.
Absolutely.
Well, that's all the time we have for today, but We hope you found this deep dive into healthcare news informative and engaging.
And we hope it's inspired you to stay curious and stay involved in the conversation about healthcare.
Because at the end of the day, healthcare affects all of us.
It does. It's something that connects us all.
So until next time, stay well, everyone.
Keep learning.